Hi, my name is Andy Masambas. I'm a level 4 student of BSS. This is my clinical assessment. So you can come in. Hi, nice to meet you.
Alright, okay.
I've checked your questionnaires and MCCs. So one things I'm just gonna go basic things. I'm gonna see you walking. So what I'm gonna get you to walk is just I'm trying to look into things like which is not normal, like lumping, out of balance, muscle strains, anything that it's unusual, it's unusual, shouldn't be there. So I'm just gonna assess you how you're walking, so I can take things from there. If you don't mind, I just want you to walk from here near the mirror, then you can come back and so just noticing. Hmm. Well, everything seems to be there. You're walking perfectly fine for me. So one thing I'm just gonna check the alignment of the shoulders. Let's see that. It seems like your shoulders a bit too broad. Is it what too much tucked in? It's kind of an impact on your pectorals. So it's about curving the back of the spine looking perfectly fine. But this one's can lead a bit of a kind of a pain when you go and exercise in the gyms and that a lot. So next thing I'm just arms looking, the elbows looking perfectly fine, wrist fine, waist areas, the knees. So I'm just checking for, I'm just trying to check for the head of the tibia. Check for the head of the tibials, medials, tibia. Seems everything seems to be fine. Everything seems to be in place. There's no bruises. There's no lumpers. There's no muscles bulk. So everything seems to be perfectly fine. But there's a bit of a difference in here because this one is a bit come a bit forward. This one is a bit back heading. So seems a bit of a lack of muscles on the back of the hamstrings area. Similar, if you don't mind, can you sit down, please? So basically, what I'm just trying to, get a bit more further, trying to be analyzing a bit properly, more in depth, trying to check, make sure everything is right with you.
Right.
So I'm just gonna check your right leg, trying to check on the patellas, medials, and then the head of the fibula, the tuberosity, the front of it. Seems like the medial is right in place. There's nothing wrong. Everything seems to be right. There's a right movement in the patella. It's stable. It's right. It's in where it should be. Seems to be fine. No bruises, no lumps, no muscle, no knots, no nothing. I'm gonna check this leg there. Just check doing the same. Checking the medials, taking everything. Seeing the medials, everything's the patella and the tuberosity, everything seems to be in place. There's nothing wrong with it. No bruises, no lumps, no muscle bulks. Everything seems to be perfectly fine. If you don't mind, I would like you to lie down. So what I'm gonna try to do here is I'm just trying to see how far, trying to do some resistance strengths and then trying to see how far yourself can push your legs back to your glutes max. Trying to see the range of the movement between the two legs. Trying to see if I can notice anything different or anything should it be in there, any unusual stuff that shouldn't be there, so I can work it out. If any problems wrong, then we can take it further from there. So if you don't mind, I would like you to lift your legs, these ones, trying to lift it further as you can back to your glutes. Is that how far you can get?
Yeah.
So when you're doing the range of the movement, what I want you, a bit of communications, I want to know, like, do you feel any pain or any muscle stressing in the hamstrings area when you're contracting it?
No.
Nothing?
No.
So can you bring it down for me? If you don't mind, you can do it with the other legs as well. Just bring it backward to your glutes. So when you're doing it, what do you feel? Do you feel any pains?
No,
Any
right now.
muscle stress? Nothing?
No.
No stress in the muscle? You can relax it now? Good. So now I'm just gonna I'm just gonna put my hands up on your tibials. So what you do is I'm just gonna support you to help you trying to push it, trying to see a bit of a resistance, trying to see how it goes, if we can identify anything of difference there. Can you push it? Can you push it?
Yeah.
Is that how far you can go?
Yeah.
Perfect. I'm looking at here, metastasis, no things. On the patellas, here's images. The knees, everything seems to be perfect, fine. There's no pain. When I'm touching, do you feel any pain?
No.
Nothing?
No.
Any hamstrings area? Nothing?
No.
Okay, seems no lump, no anything's unusual, no fluid, no attachment. Everything seems to be right in place. Can you bring it down? So same things. I'm just gonna apply the same technique I just did on the other legs. I'm just gonna try to push a bit back to your glutes. Is that fine now?
Yeah.
Do you feel any pain?
I don't know.
No pains on the hamstrings, in the gastrinium, nothing. When I'm touching, can you feel any pains?
No.
Yes. Seems everything, the ligament is attached, the patella is fine, the medius, the tibial thoracic, everything seems to be fine in place. There's nothing wrong there. Right, everything seems to be perfect. You pull it down. So now is gonna do a bit of a resistance, right?
Right.
So what is, first of all, we're gonna do different types of. First of all, we're trying to bring it backward to your glutes. I'm gonna put a bit of a pressure,
Right.
but you're trying to use your force against my palm, trying to push it backward to your glutes.
Right.
So you're trying to see, and if you feel any, you notice anything unusual like pains or muscle straining, you just let me know. But while I'll identify myself, but you let me know how you feel. Let's go. Trying to push it backward. Do you feel any tightness in the muscles?
No.
Nothing? Trying to push again? Now relax. Good. I'm gonna try to apply the same technique on the leg. Now, okay, same technique. Trying to bring it backward to the glutes. Can you feel anything unusual?
No.
Nothing. So everything seems to be perfectly fine. There's nothing. So now we're gonna apply. Now legs up. Now we're trying to move. Trying to bring your legs back down to the floor. So now I want you to apply the same pressures. Everything seems to be. There's nothing. How do you feel? Any pain?
No.
Everything seems to be fine, perfectly fine. The alignment, then the ligaments, everything seems to be perfect. So I'm gonna try the same things here again. Let's go pressure down. Do you feel anything?
No.
Alright, the muscles seem, everything seems to be perfectly fine. There's nothing wrong. Now relax. Well, you can sit up, sir. Well, according to the analysis and the examinations are done, you seem to be perfectly fine. Well, what I can just advise you, but based on my knowledge, based on what I just examined, is just go see a massage therapist just to check up on your shoulder areas, give a couple of massage, couple of sessions, just trying to alignment for the back, just to help you on the victorious when you're training and to avoid any bend of the back on the spine areas will be perfect. Apart from that, everything is fine. And the heel is not really a problem because one knee is a bit up in it, so I just like massage is where it is. But the alignment of the feet as well was perfect when I checked. I forgot to tell you about that, but everything seems to be in the right in place. There's nothing wrong really. We did the passive, we did the active, and we did the resistance. Seems everything is fine. You're a really active person, so I really appreciate it. Thank you very much for your time.